South Korea has a lot of titles under its belt, rising from the ashes of the Korean War to becoming the world's 10th largest economy. But despite the remarkable economic growth, the nation struggles with individual happiness, frequently ranking low on related indices. It has the highest suicide rate among OECD member nations, and more people died from suicide than COVID-19 during the pandemic, according to the health ministry. Numerous scholars around the world have looked into why South Koreans aren't happy. In response, the government has announced plans to reform the nation's mental health policies to better support those suffering from mental illnesses. On today's Within the Frame, we get a deep dive into Korea's mental health problems, optimal direction for reform, and explore lessons from other advanced nations that have undertaken similar paths. For some insights, we have Professor Hwang Sun-mi at Torch Trinity Graduate University joining us virtually. It's so great to have you with us.
Glad to be here.
And for a U.S. perspective, Michael Bernstein, professor of psychology at Penn State Abington, joins us from Pennsylvania. Welcome to the program.
Hi, thank you so much for having me.
All right, Professor Hwang, let's kick things off with you. President Yoon Suk-yeol has vowed an overhaul of the nation's mental health policy, promising to create a new presidential committee dedicated to overseeing mental health issues among Korean citizens. Does this indicate that the mental health of South Koreans has deteriorated to a level where it demands national attention?
Well, unfortunately, I have to say yes. South Korea has been at the highest suicide rate among OECD countries for over decades. As we all know, this trend has been consistent since early 2000, which means we now have two major assignments to solve. First, of course, we need to figure out what causes the individual make the self-injured choices and how to reduce it. But on the top of that, we have to take care of the rest ones too. Who has to be exposed to the news several times and have to live with the ongoing grief. That will be our second assignment. One person's mental health problem, I'm not talking about just the suicide itself, but I mean the diverse kind of psychological distress in daily life deeply affect the people around the person, like family, colleague, and friend. Because we live in such a small society and we are all connected to each other. If we remember, recently we lost several celebrities to suicide. We all experienced the loss of the shared moments with them. And people also lost the future opportunities to have a dream with them and have grow with them. The scope of loss is larger than we expected. Unfortunately, according to the World Happiness Report this year, South Korea ranks 52nd in the world in terms of happiness index. Subjective feeling of happiness is psychological resource that individuals cope with daily stresses. A low level of happiness, therefore, indicates that we may be more vulnerable to emotional stress. People seek professional counseling for different reasons, but common issue includes the feeling of unhappiness that we are talking about right now, and depressive feelings, this is the major one, mood fluctuation, and various anxiety-related symptoms. And I have been experiencing that the level of symptoms that people are reporting are gradually getting severe. So yes, indeed, I think South Korea has reached the point where we all have to take a serious action for it.
You just mentioned about the World Happiness Report, and in another global survey, South Korea's life satisfaction level ranked 35th out of 38 nations between 2020 and 2022, according to recent data. So clearly, there is widespread unhappiness among South Koreans. Hopefully, the envisioned presidential committee, the first of its kind, will help address the country's worsening mental health issues. Now, Dr. Bernstein, I understand that the UK has a government minister to lead suicide prevention efforts, while Japan has a minister of loneliness to help alleviate the social isolation of certain groups of people. Are most advanced economies addressing mental health issues through national policies?
It's a great question. And the answer is that there's quite a bit of variability, but there are a lot of countries that are engaged in mental health policies to try to address these issues. So in the U.S., the U.S. Surgeon General last year declared a national loneliness and social isolation epidemic throughout the country. The head of the African Union Youth Envoy identified loneliness as a significant threat to mental health, as well as directing resources or asking for resources to be directed to other mental health issues in the African Union. And the WHO just commissioned a new commission on social connection, citing the absolute importance to social connection and how this plays a role in mental health. So there is quite a bit of activity among governmental agencies trying to address mental health. And some countries take more active steps by the government to address these actions. And sometimes that's about directing resources and funding to identify interventions. And sometimes it's about actually enacting those interventions in respective populations. These programs are often aimed at children in primary schools, adults in communities, or seniors for whom these sorts of interventions can be extremely effective in promoting mental health. But the World Bank recently came out and said that all countries are considered developing countries in the context of mental health, as all are lagging in addressing the growing burden. So even though there's a lot of work being done in many countries, even in these most advanced economies, there's still quite a bit of work left to be done.
So the specific measures may vary, but it sounds like many developed countries, such as the UK, many European countries, as well as Australia, have comprehensive national mental health policies. And in case of the US, the country has a policy at the state or provincial level rather than the national level, which we'll discuss more in a bit. But before that, Professor Hwang, a recent survey by South Korea's health ministry showed that the majority of Koreans think that the government's suicide prevention efforts actually help. From your perspective, are national level policies and efforts effective in suicide prevention?
Of course, definitely. I agree that the intervention at the national level has a significant impact. The nature of suicidal intervention should be prevention because once suicide occurs, it cannot be reversed. So prevention efforts must be proactive, like a hotline system and primary crisis counseling centers should be available 24 hours, 7 days. Establishing these facilities and staffing them requires quite amount of money, which makes impossible other than nationwide services. When discussing national suicide prevention policies, Finland is the good example that cannot be overlooked. In the 1990s, Finland has a suicide rate that was twice more than OECD average. But since taking proactive measures starting in 1992, Finland has made remarkable progress in suicide prevention. The suicide rate, which was once 30 per 100,000 people, dropped to 12.9 by 2020. And this number is about half of the suicide rate recent years of Korea. And Japan is another country made a reduction in suicidal attempt. For instance, Japan no longer ranks second after Korea. Its ranking has dropped. Those two countries established community support counseling centers and network where individuals can easily find the professional help. Providing hotline service is a very important initial crisis intervention. And I think implementing workplace welfare program and take care of employees' mental health is really crucial because a lot of Koreans, majority of Koreans spend a lot of time in workplaces. Promoting public awareness campaigns to reduce stigma around mental health issues and suicide encourage people to seek help early. But these interventions have been pursued in Korea as well. Well, however, what seems to helpful is to build up such effort into national policies, set clear objectives, and consistent drive toward the singular goal of protecting the possible loss. Well, I think suicide may seem very individual issue, but if we address this issue collectively, and if society collectively send a message when there is somebody for you, then this can be addressed effectively.
Professor Bernstein, it's known that 1 in 5 U.S. adults lives with a mental illness. Give us a bird's eye view of the framework of mental health policies in the U.S.
Of course. So Professor Huang is absolutely right concerning the significance of the issues of mental health, and also that this is a collective action problem. They're a very significant concern in the U.S., and recently the Biden administration has tried to engage in kind of steps towards addressing these issues. They've expanded funding for access to the National Suicide Prevention Lifeline, a good example of a service that cannot occur at the individual level, that really is best rolled out at the national level. A huge barrier to mental health is people having access to support and care. There's a significant workforce shortage, and the administration recently took steps through the Department of Veterans Affairs and the Department of Defense to hire more personnel to actually attend to mental health among its respective populations that they serve. They've also done quite a bit of work to fund certified community behavioral health centers, which provide 24/7 comprehensive primary and behavioral health care. So these are organizations that exist within a community, staffed by members of the community, by community partners, and are available 24/7 to address sort of these concerns. The Department of Health and Human Services expanded access to local communities through a mental health crisis response partnership pilot program, again, allowing community partners to kind of develop interventions and ways of helping their communities. And there's also been work done by the Department of Health and Human Services for people in long-term care facilities. This is a place where mental health problems are often rather significant because of, again, social isolation and loneliness. Again, though, there's quite a bit of work left to be done, and I'm hoping for more resources to be directed in these ways.
Thank you for that great summary of a wide range of measures being taken in the U.S. Professor Huang, President Yoon has vowed to provide psychological counseling services to 1 million people during his term. But due to Korea's strong social stigma surrounding mental illnesses, many are hesitant to seek professional help, even when experiencing mental health issues. How does the number of people undergoing psychological counseling in Korea compare to that in other advanced countries like the U.S. or the U.K.?
Okay, as you said, starting from this July of this year, the Korean government has launched the government support program called 마음 투자. One of the main purpose of this program is to reach to the 1% of Korean population to receive the professional counseling and psychological services. Actually, the 마음 투자 was not the first step. And in the last 5 years or so, there have been government-supported counseling services for young adult people, for the victims of sexual violences and stalking violences in Korea. And as a mental health professional, I also participated in these programs to provide counseling services. And I have certainly seen the younger the population is, the easier it is to get for the professional help. However, the problem is that these supports are mainly provided in Seoul and Gyeonggi area. Therefore, qualified institutions to get help are also concentrated in Seoul and Gyeonggi area. Naturally, two problems become our remaining homework. The first is to provide better hospital and better counseling centers in every provinces of Korea. And the second is to make the service much more easier and accessible to the older generation and to the people who has less educated populations. because these people tend to be the one lack social information, avoid help, and isolate themselves. And for the fear of social stigma, as you said, despite severe mental illnesses. Statistics show that the visit to mental health services are 22.2% in Korea and 39.5% in Belgium, 46.5% in Canada, and 43.1% in the United States. But as I already mentioned, we have to diagnose this number by age and region. And I think if one particular population's engagement rate drops significantly, we need to promote it in a way that proper way for the population and make it much more easier to get it.
I'm sure there are people out there here in Korea that want to reach out, that want to seek professional help, but are, they refrain from doing that because of all the negative aspects that come with it. They're worried about a lot of things. Of course, they're worried about the strong social stigma. So I think it's really time for us to make a change and make those psychiatric help much more accessible for them. And the tasks that you listed are, I think you highlighted the very important tasks that we need to address to get there. Now, Professor Bernstein, the U.S. has been expanding measures to provide community-based services to help people with mental illnesses. Could you tell us a bit about this and also about the Healthy People 2030 initiative? Have they been effective?
These are great questions and happy to do so. So as I mentioned before, the U.S. has been looking at a number of ways for community partnerships. The Certified Community Behavioral Health Centers developed by or funded in part by Health and Human Services have been really helpful, in part because they do exactly what we were just talking about. They're trying to destigmatize by using members of the community to normalize that mental health is like anything else. We would very few of us would be upset if we had a broken finger or a laceration in going to the doctor. We wouldn't feel as though that was stigmatizing because we see physical health as something that could be treated and that isn't our fault, because it's not. But for mental health, we often feel as though we're to blame or we're going to be judged for this. And as a result, we don't seek professional help. So these community-based partners are really aiming to try to normalize getting support for mental health, and that mental health is something that lots of people need support with. And so these local governments within the United States are often finding ways to create centers where experts can be part of the community, often from the community, to support the communities themselves. To your second question about Healthy People 2030, this is a 10-year plan by the U.S. Department of Health and Human Services. It launched late in 2020, so we're about 4 years in, and it has the overarching goal of improving health and well-being for all people across their lives, and in particular to eliminate health disparities. There are obviously health disparities that exist within the U.S. This is true for many cultures, and so the Healthy People 2030 is trying to find ways to reduce those disparities. And very briefly, it looks at 5 determinants of social health, things that are within the control or the ability to change much more easily than things like genetics or things like personal behavior. And those 5 things are kind of economic stability, educational access and quality, healthcare access and quality, neighborhoods and built environments like having safe housing and good transportation, access to food, and then social and community context, making sure that people have the social support through mentors and community members. And I think some aspects of the program are more successful than others. They're actually constantly examining their own data and updating their website. It's actually a very nice website where you can go and see of their measures that they're kind of evaluating themselves on, how are they doing, and you can see the data they use to determine whether or not they're succeeding or they haven't done enough, or in some cases things have gotten a little worse.
Well, studies have shown over time that community-based mental health policies, those services, reduce stigma and inequalities. So there's a lot we can learn from the various initiatives taken by the U.S., which leads us to our next question. Professor Hwang, the Yoon administration has rolled out ambitious tasks for the new presidential committee. It aims to increase the number of mental health emergency medical centers threefold while building more mental rehabilitation facilities across the country. And it also plans to provide new homes for those with mental illnesses each year. But all these measures will need cooperation from communities. What are some lessons we can learn from the U.S.?
Well, the situation between the United States and Korea is different. So we cannot just follow the examples of the United States exactly. The same goes for other countries also. Healthy People 2030 focus on the prevention, screening, assessment, and treatment of mental disorders. The Liner model looks perfectly ideal, but only in a society where psychological assessment and treatment are well equipped. I think for Korea, we need to work harder on early crisis response and fast and accurate diagnosis first. I personally believe that we need more diagnostic experts than we do right now, and we need to gather more basic research data for later. And depending on the diagnosis, we also need a manual that all experts can follow the same sequences. Community care, indeed, of the United States, which promote more people to serve each other, is something we can learn from, I think. The community care policies emphasize peer support, mutual aid by giving and receiving volunteering help, and supportive group for people who are having similar circumstances. Promoting community care is challenging for Korea, though, because Korea is where everybody is busy and individualism is increasing, and majority of housing is apartment. So we are not yet clearly can have the answer for that yet, but we should create our own community care in a way that that's right for our culture.
And our last question is also for you, Professor Hwang. What direction should South Korea's mental health policy reform take, and what are your prospects?
I felt very a great news. I felt it was a great news that Korean government shows interest and effort in improving the mental health of people. As a mental health professional who closely witnesses people's psychological distress, daily lives, I feel released to hear that news. But I hope, though, that the policy will take a long-term perspective, because the psychological issue people experience today have been shaped over several generations. In family counseling, there is a concept called homeostasis, where people actively create coping mechanisms to survive, even though their suffering may appear only a problem. Therefore, trying to eliminate or change in a short period of the time could lead to unexpected problems and increase people's reluctance to change. It would be helpful if the government could anticipate some of these phenomena and respond with long-term perspective. Long-term perspective is really important, I think. And also, it would be also beneficial to involve more mental health professionals in administrating these policies. Another important opinion I want to add is importance of prevention itself. If people seek help early, we can reduce the severity of mental health symptoms. So just as government show interest in high-risk groups, I think it's important there's also a need to focus on the ordinary people who may experience a mild psychological distress, because those are the people, and those who recover from mild distress can actually become our human resources we talked about before. And those people become the capable of community care. So my expectation is to have a long-term perspective and have more effort to prevention.
All right, it's a perfect place to end our discussion today. Thank you so much, Professor Hwang and Professor Bernstein, for sharing your insights with us today.
Thank you.
Thank you.
And that brings us to the end of the show. Thank you for watching, and be sure to tune in same time tomorrow to join our conversation. Goodbye for now.